Good evening, ladies and gentlemen. My name is Stephen Crowley, and I'm here to inform you on a topic that you may not know a lot about, just because it's not on the news very often, and that's the VA healthcare system and the challenges that they are currently facing. First, I would like to start off with a little story. This is David Grant Medical Facility. I had the opportunity to work there for about 6 months, and I came across a gentleman that discussed his hardships with me on making an appointment through the VA healthcare system. He called to make his yearly checkup for his diabetes, and they told him to call back at a later date because there were no available slots. Months passed by, and he never got an appointment. The only way he ended up being seen was because he admitted himself into the emergency room, and that's where I came across him, and he told me about the hardships that he suffered. It's completely unacceptable that a patient has to wait months and not even get an appointment to the point where they have to admit themselves into the emergency room. So a little bit about me. I'm a medical technician in the United States Air Force. I've been in the Air Force for about 2 years now, and I've experienced these hardships firsthand. So why does this matter to you? First off, these are your tax dollars being spent towards this program that lacks profound deficiencies. $68 billion per year get poured into the VA healthcare system, and there are still problems and challenges that they face. Secondly, people like this gentleman right here who served our country are not getting the proper care that they require. So a little bit about the VA, or the VHA. VHA stands for Veteran Health Administration. Their mission statement is to provide exceptional care at all costs. The VA is the largest integrated healthcare system consisting of 1,243 healthcare facilities. They currently have a patient load of 9 million veterans, and that number is rapidly growing. Along with their mission statement of providing exceptional care, they set a goal to provide the benchmark of excellence. A little bit about their manpower. They currently have 73,000 active volunteers, 306,000 full-time members, and 127,000 healthcare trainees. By healthcare trainees, I mean doctors that just graduated medical school and are still going through their internships in order to get their certifications. So what's going on and what's the problem? One of the biggest challenges that the VA healthcare system is facing is wait times. Patients wait weeks to months, just like the gentleman I spoke about earlier, just to see a healthcare provider. These are just examples of the New Jersey VA healthcare system and their wait times. Burlington County is 50 days. 50 days in an extremely large window for something to go wrong. So what could go wrong? The patient can run out of medication, or they can face medical complications leading into injury further down the road. These wait times create something called medical shockwave. Medical shockwave is when a patient is unable to see the doctor, and it causes a multitude of effects on them. Some instances of medical shockwave are, according to Art Levine in the article How the VA Fueled the Opioid Crisis, veterans are twice likely to die from an opioid overdose. In another article, Veteran Services, they found that 18 veterans were committing suicide per day. So what causes this? The main cause of all of this is patient wait times. This creates a delay in processing of mental health claims and their ability to go see a doctor. These wait times create an unsafe environment. It was found that the VA suffers profound deficiencies by Mr. Phillips in his article Care by Private Doctors. Mr. Phillips suggested that the VA establish private care. By private care, I mean that the patients are able to go see their private doctor of their choosing, instead of currently having to go within the 75-mile radius to a VA healthcare hospital. The problem with that idea is that the doctors currently lack incentive, because under the VA healthcare insurance, doctors are paid less for treating these patients. So what's causing all this? Well, the main problem is patient load. The VA is unable to handle the 9 million and growing patient load. Their systems are incapable of processing all these claims, and by that I mean the government computers, when updates are pushed through them, they do not work very well, causing loss of information on patients. This is something that I have experienced firsthand at my Air Force Base. And it also comes down, they just don't have enough personnel. Another problem is the personnel is unqualified. When almost half of your staff is made up of medical trainees, 127,000 medical trainees that are just recent graduates and don't even have their license yet, and they're the ones treating the patients, that leads to multiple problems. This creates a backup of patients. When a backup of patient occurs, their care suffers. Patients get pushed through the medical system just so they can dwindle down their quota of patients that are still waiting in line. So to conclude, clearly the VA is suffering from profound deficiencies and problems. While changes are being put into place, we hope to see in the near future that patients will be able to see private care doctors, just like Mr. Phillips spoke of. If they are able to see private care doctors, this will help dwindle down the patient load and will prevent that medical shockwave that I discussed earlier. When veterans are dying at an alarming rate, it is clear that changes are necessary, and everyone knows it. Hopefully these changes will take place soon enough.